people they listen to Sabi Radio. Omoluwabi Radio 87.7 FM, na dem be Sabi Radio.
It's 2 p.m. on Omoluwabi 87.7 FM.
You know that health is wealth and ital is vital. They're not just some rhyming words. It's something that's just got to be heard. Who is responsible for your health? Look in the mirror, it's your very own self. You can't rely on nobody else.
Your health is your wealth. Hey, hey. It keeps you alive. Your health is your wealth. No one can deny. It keeps you alive. Your health is your wealth. Hey, hey. It keeps you alive. Our health is our wealth. It keeps us up. As one. Oh, 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 oh. Oh, 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 oh. Oh, 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 oh. Your health is your wealth. No one can deny. It keeps you alive. Hey, hey. Your health is your wealth. It keeps you alive. Your health is your wealth. No one can debate. It keeps you alive. Our health is our wealth. It keeps us surviving. There is one. Your health is your wealth. Hey, hey. It keeps you alive. Your health is your wealth. No one can deny. It keeps you alive. Your health is your wealth. Hey, hey.
Yes, your health is your wealth and it keeps you alive. Welcome to another wonderful edition of Health Plus right here at Omoluwabi Radio 87.7 FM. My name is Omoluwabi and I'm your wonderful host for today. Immediate first aid can make a real difference. You can be a hero by providing first aid when the time comes. Yes, immediate first aid can be a real difference, and you can be a hero by learning and providing first aid when the time comes. And with this quote, I'm using to welcome you to another brown and wonderful edition of Health Plus. As you all know, that Health Plus is a program where we sensitize the general public on how to take care of their health and keep them safe and sound so as they can stay away from the hospital. And today, we are not going to be doing anything different on the show. We are going to be doing the normal things, but it is going to be a very wonderful and interactive topic that we are going to be discussing today, because as you know that we have the health news and we have the health tips. So I'm going to be giving you every of these parts of it. And today we are going to be discussing a very, very important topic that people really do not, they really want to shy away from it. I don't want to say they do shy away from it, but they don't see it as something that is very important. They see it as something that it is only the medical practitioners that has the right to do it. Meanwhile, anybody can be of help on this particular topic. And what is the topic of discussion for today? We'll be talking about first aid and emergency. First aid and emergency. Yes, I'm sure some people will be wondering, like, okay, what has first aid got to do? Why do I have to even go into first aid? Why do I have to render first aid to someone? Yes, first aid is a very, very crucial thing, and when an accident occurs or when anything happens around us, the first aid we render to the victims around these circumstances is very, very crucial, and immediate first aid can actually save life a long way. Today, that's why I said we are going to be addressing this topic today. Okay, globally, the lack of immediate access to first aid contributes a significant number of preventable deaths. And according to WHO, approximately 5 million people dies each year in low-income and middle-income countries, including Nigeria, due to poor or lack of quality first aid on time. In many emergencies, the first few moments are very crucial. Without trained respondents or access to base first aid, lives can be lost. This issue is further compounded by the absence of adequate first aid kits in key locations such as the workplace, schools, home, and public areas, leaving even trained individuals with limited capacity to provide effective care. Raising awareness and promoting training in first aid is essential for empowering the public, and that is why I've decided to talk on this topic today, so that we can we can all learn, like, okay, this and this is what to do when this kind of emergency occurs. It is not all emergency you say be taking them to the hospital. What have you even done as an individual at that particular moment to help that victim? And this brings us to the topic of today: first aid and emergency. And I'm pleased to introduce my wonderful guest in the house to you this afternoon. I'm having a very wonderful guest. He's an assistant chief nursing officer and a registered accident and emergency nurse in the University Teaching Hospital, UCH. Good afternoon, sir.
Good afternoon, ma.
Can you please move closer to your mic, sir? Thank you very much, sir.
Good afternoon, ma.
Good afternoon, sir. Can you please introduce yourself properly to my listeners?
Yes, once again, my name is Omoluwabi Adedayo. I'm a registered accident and emergency nurse.
Okay.
I'm also an assistant chief nursing officer at University College Hospital, Ibadan.
Okay.
So
All
I'm
right.
happy to be here.
Thank you very much, sir. Thank you very much, sir. Okay, so let's go straight into the discussion for the day.
Okay.
What are the basics of first aid? Or should I say, let me start with what is first aid?
Okay, basically, first aid, as you call it, is just a vital for saving life. And when you say vital for saving life, you will know that the first contact, they pass by people that comes across a patient on the road. It can be a patient, it can be a client. Is the first initial treatment given to someone before moving to the hospital. The initial treatment can be a patient that you see, somebody that fell on the floor, what you need to do before moving that patient to the hospital, or before you calling the first respondents. And that is the basic thing. And under normal circumstances, there's something we always call, we have a principle in first aid. The first thing is just your own safety is the most important thing. And after your own safety, the environment. When we look at the environment, is the environment safe for me and the patient? And now you now call for help. And after you have called for help, the next thing you do is just you do check on that patient immediately. All this, what I'm saying, is just within a ticking of a minute. You understand? Without wasting time. Because anytime you waste, you miss.
The time is ticking.
It's ticking, and you are missing. You are missing one. You are missing the adequate care of that patient. After that, after you have make a call and a lot of people are coming, the first thing is just you go and assess the patient, what is really happening. And one thing you need to know is that there's a three basic thing as a first aiders that we should know. The first thing is this: the airway.
Okay, that's the nostrils.
Yes, from the mouth. You look at the nostril, you look at the mouth. Is the airway patent? Is there any obstruction? And if there's no obstruction, and you look at the breathing, you look at the chest, you look at the stomach, is the patient breathing properly? If the patient is not properly breathing, that's when you go to circulation. You feel the pulse. There's some cardinal area that you feel the pulse. We have the carotid from the neck. We have the radii. We have the femoral. We have the breaker. So you feel the pulse. If there's no pulse and the patient is not breathing, that's when you commence CPR. We call it cardiopulmonary resuscitation, and that's why you intensify it. By the time you are doing that, you are waiting for the medical practitioner to come and save the patient. But two things are involved in this kind of situation. The first thing is just sometimes medical practitioner won't able to come at that particular time. So there's a need bit for you to move that patient at that area to the hospital straight for adequate treatment. So that is it.
Okay. All right. Thank you.
Yeah.
Moving on, you just answered part of my next question that I was about to ask. Okay. Because some people be like, okay, since we've actually given this person first aid, is it still necessary for the person to go to the hospital? Is it still like just taking the person to the hospital, or the person can just, okay, I'm already okay, I'm fine, I'm fit to go, and that's all?
The truth is this: no matter how you think you have saved a life, there's still a correspondent you should know that person should do a checkup, no matter how. No. Because most of the first aiders that are the first contact, they always make some mistakes. So now let me give you an example. Okay. A patient, you saw a patient that have let me say epilepsy. Okay. It's something that's very common nowadays now. Yeah. That collapse. The first thing you're going to do is just one, is that patient safe? Am I safe to go and rescue the patient? The first thing that people always do is just okay, let us put a spoon in the mouth. Okay, good. Or let us go and pour water on him. And everything. The patient is foaming. There is saliva on the mouth. The first thing you should do is just, number one, is that place where that patient fell, is there any injury? If there's any injury, you move the patient out of that place. You allow the jerking reflex and the ability, the reflex and the way the patient is breathing to calm down before you intervene. And that is it. By the time you are trying to introduce anything, the tongue can fall back. It can aspirate through the saliva. So the only thing you can do is just the only thing you need to do after the patient has a little bit calm, you put him in a recovery position. After you are putting him in a recovery position, you take him to the hospital. Because plus or minus, you need to run out some tests.
To know the actual cause.
And when you get to the hospital, they are also going to triage. This is another topic on its own. Triaging, that sorting out and everything. So that's it. All right. So you move to the hospital.
Okay. So talking about first aid. When we were growing up, there was something they taught us back in school: the first aid box and all the kits inside the first aid box. Yes. So, can you just make mention of some of those kits, some of those necessary kits that should actually be in the
first aid box differs, because one thing I always tell people is just, I would say every institution supposed to have a first aid box. The first aid box that will be at a working place is different from the school. Okay. The one that will be inside the car is different.
From the one at home.
At home. And the one that is in the at home will differ from the one in your facility. But basically there's some materials that are so essential. Number one is your gauze. Okay. The gauze, they call it a pad gauze. Number two, scissors. Number three, your some people call it plaster, but some people call it tape. And again, you need to have a ruler.
Okay, in case of dislocation.
Dislocation. But most of the cases, people use stick. Available thing. That's they use stick. So you have iodine, spirits, and these are the essential things that are supposed to be inside the first aid box. And above all, you need to have a bandage. We have different type of bandage also, but you must have a crepe bandage. So you put it there. In school, you have other things like paracetamol and all these things for basic thing for the children and everything. So that is it.
Okay. So what you are saying in general now is that because when you were talking earlier, you said we have different types of first aid box depending on where they are being used. These are the things you just mentioned just now, are the general things that should be in the first aid. But now I want you to analyze, okay, in a working organization, what are the essential things that should be in a first aid? In let's say in a school, we know there should be pain relief and every other thing in the first aid. Okay, for the sports people, what should be in their first aid kit? Because some people love sports a lot. They go out, they go sportsing, and maybe they get injured, and they are with the first aid box, but they don't know what should be in the first aid box.
Okay, thank you so much. Let's start with the sports.
Okay.
Now, the first thing you need to have there is, we call it cold compress. Cold compress is something like an ice.
Okay.
You understand? Because when they fall, they mount it on the affected area, so that because when they fall, there was a kind of physiological changes in that place. So there will be a swelling, and you have to put cold compress on it. And sometimes we have something we call cold spray or heat spray. So those are the items that will be inside that. And we also have the cream. The cream, you rub it topically. It's not that you massage. You don't massage. Okay. By the time you massage, you are causing another arm on the leg again. It's just apply gently on it. After you apply it on it, you leave it alone. Now, if need be, you need to bandage. You bandage it. So bandage will be there. Your spirit and cotton wool be there. And moreover, sometimes they might have bruises. So you will have Provident iodine. Sometimes we don't use iodine. It has been long that we use iodine, because so we don't use iodine. So we use Provident iodine. So you have your plasters, and sometimes, because of emergency cases, there can be, we call it normal saline. Normal saline is used to clean the wound. You don't use water. It's normal saline, because that normal saline contains water and salt. So use it to clean the wound. So these are the items that will be on the first aid kit
for a sports person.
In school, it can be the same, because of the children when they're doing sport or running on during their break time. It can be the same thing inside. But the only difference is just like they can include some minor pain relief. And vitamin C, Bico, and because of their sick bay. So after most of the cases, when they do that, after they have done their own proper assessment, if they cannot properly manage, they move to the hospital. And that is it. At place of work, you don't need those items I'm mentioning, because there's no activities of fall and everything. But the only thing, they could be, but plus or minus. The only thing that can, because of when you're talking about emergency case, we have different types. We have the medical, we have the surgical, we have the pediatrics, which are the children, we have the gynecological. So it's a different thing. So it not depends. So it's just like a broad topic. But people doesn't understand that. But one thing is just time wasting. When you are trying to save life is so important. You focus on the patients and the clients, and you do your work. And you move the patient to the hospital. The basic thing you need to do is a basic thing you need to do when you see any victims, just to at least to stabilize the person, and you put that patient in a recovery position, and you get to the hospital. Do you understand? Right. So that is it, ma'am.
Okay. So for first aid for cars and the home.
Yes, first aid for the car. You have home and car. Let me put it together.
Okay.
You have your gauze. You have your scissors. You have your crepe bandage. You have your iodine. You have your what's it called, ice pack. Okay. Sometimes we have different ice pack because it easily dissolve. You understand? So there's different one. There's a one that you do. There's a case that after you already prepared it, put it inside the refrigerator. You put it in a safe place, and you are good to go. Okay. So that is it. You have your spray, which is DP spray or coat spray. You put it inside, and that is it. And again, you put glucose inside also. Because sometimes people get exhausted and you miss glucose inside the energy to back. So you can put it inside also. Okay. So that's it.
All right. Thank you. Okay, I will be going on a short break right now, on a commercial break right now. And when we are back, Health Plus still continues right here at Omoluwabi Radio 87.7 FM. Don't go anywhere.
Your health is your wealth. Hey, hey. It keeps you alive.
Fresh news, best talk, hot music, where else?
Omoluwabi 87.7 FM.
This is calling on all telecom subscribers who are yet to link their national identity number with their SIM to visit the nearest office of their service provider with a valid NIN for verification and linkage, or risk losing the lines permanently. Your service provider will confirm your national identification number in the database of the National Identity Management Commission, NIMC, and help recover the bad number after successfully linking your NIN with your SIM. A link will then be sent to you to automatically link your NIN with your phone number. This message is brought to you by the Nigerian Communications Commission, NCC.
We are everywhere you go. In your office, at the market, the motor park, even at the filling stations. Feel the voice of integrity. Omoluwabi 87.7 FM.
Omoluwabi 87.7 FM.
Vegetables, they're really good. They'll give you energy. You should eat them in a meal 3 times a day. Carrots, broccoli, spinach, even peas. Look at all the colors. It's what you need. Healthy eating makes you wanna dance. Clap your hands and jump around and say, yes, I can. Healthy eating makes you really strong. Your brain and body will really get along.
Your health is your wealth.
Yeah, welcome back from that commercial break. It is still Omoluwabi Radio 87.7 FM, and the program is Health Plus. And the topic of our discussion today is first aid and emergency. And with me in the studio today, I have a nurse from the Department of Emergency and Accident and Emergency, UCH, Nurse Shegun Adebayo. Okay, and we've discussed some things about emergency and first aid. So I'll be asking, for our listeners' sake, I want you to give some examples and conditions of injuries and accident that requires first aid, quick first aid intervention.
Okay, thank you so much. To start with, we have fractures. When you have road traffic accidents, most of the cases, some passengers, they have fractures. So, and we thank the FRSC people. Most of the times, they are the one that always rescue them.
Yes.
And the truth is this: when they are trying to rescue, they had to save their lives. And one thing that when they have a fractures, they had to secure the bleeding. You understand? After securing the bleeding, they mobilize the leg and they make them in a recovery position. And we call it recovery position, so that at least they can be pretty much okay. Sometimes we have the sprain, because some people sprain their leg, which is the ligament. It affects the ligaments. So it can be as a result when you stretch your leg too much, or a tear, and that is it. So again, you can have also a strain. When you strain yourself, when you strain your leg also is part of it. So basically, we have different type of fracture, and that is it. And it affects different parts of the body. And when it affects a part of the body, it's just like a break in the continuation of the bone, and that is it. If it is a fracture that doesn't come out, we have open fracture, we have closed fracture. The open fractures is the one that you see that there's a lot of wound is open outside, and the patient might be bleeding from the arteries or from the vein. Do you understand? So you need to be secured. So that is why you see a lot of people, they will use the patient close to tight, and sometimes that's why we talk about infection, and because it's not really safe. But firstly, they are trying to save life. That's it. By the time you do that, they move, or when the first aiders or the emergency response comes, they move to the hospital, they do the needful. But basically, the three things that primarily involved is the fracture, sprain, and train. That's the three things that really involved.
That really involves first aid intervention. Okay.
But that is under surgical aspects.
Okay.
Under medical aspects, we are talking about a patient that has an hypertension, patient that is diabetics. Hypertension because one, the blood pressure is already high. You understand? And nowadays, people are not using their medication. And they always believe that God will do it, which God has been doing it, but you need to take your medication, and which is so essential. And by the time they will be feeling uncomfortable, they can collapse and they can have stroke. And that is when you see them going unconscious. And when they go unconscious, sometimes people pour water on them, which is not necessary. You don't need to pour water. Because one, by you pouring water, they can you are still causing more harm, damage on the patient. Immediately move the patient to the hospital. Your own is just to assess and see. Your assessment basically for all first aid respondent is one thing you should understand is your airway, breathing, and circulation. And I always say that we should start from the grassroots, from the schools, church, mosque, companies. Everybody can be a first aider. And that's the truth.
So anybody can train to be.
You can be, yes, everybody can be. Every 3 months, 6 months, a year, you could be doing it. And you should you should be perfect in your CPR, cardiopulmonary resuscitation. And that is the truth. And there was an incident that happened with a patient that collapsed. They was thinking maybe, no, he hasn't eaten. Unfortunately, he's a diabetic patient. He was having hypoglycemia. The sugar level has dropped. One thing I always say, if it's already sugar rather, you put in the mouth, the patient will come around. And that is it. And if it is ordinary Coke, just sip, at least you'll come around, you do your intervention, you move to the hospital, just to shoot the sugar level up, and then you continue your line of management in the hospital. But people doesn't understand there's difference between hyperglycemia and hypoglycemia. It is when you check the sugar level that you know which one is it. Because when you are trying to do an intervention, maybe that person is having hypoglycemia and you're not administering it, you're causing more harm.
Yeah. It's going to increase.
So that is why you know that all these they are so broad. You cannot even focus on one or two. But the only thing is just the most important that is significant to all of them is one, you check their airway, breathing, and circulation. And if you have achieved that, you're good to go. Call the emergency response. Let them take the care. Because one, emergency response also do some things. Inside the ambulance, they have also kits. By the time they do their kit, they do some basic things. And they know, they will have called. Now, some years back, I was working with Critical Rescue International in Lagos. And when we have a call center, and I was on the ambulance then. When they call us, they will say, there's an accident around that area. When we get there, after we have finished with our own assessments, we will tell them that, okay, we need this. Why are we saying that? Because one, they should prepare for us ahead. Why we are continuing resuscitating the patient from the site to the ambulance, from the ambulance to the hospital, and that is it. So it should be interwoven. And when you are doing this, you don't waste time. Time is precious. And that is the basic thing. Patients that you see that, like a personal patient now, that you see that when you have done your ABC and you get that the patient is doing, and the patients need oxygen. You don't have oxygen in you move the patient to the hospital. And when you move the patient, they commence on oxygen. You do your basic vitals, and you see, oh, this patient is the BP is low. Okay, what can we do? Took the blood sample, do a lot of things.
Run tests.
The nurses, the doctors are doing wonderfully, and there's a kind of collaboration, and that is it. And that is why when you save life, you have the joy that, oh, I saved life today. And that is it.
And that's why most doctors smile when they see their patients recovering.
Yes.
Oh, okay. We're coming up the phone lines in case you want to join or you want to ask any question. The phone lines to call are 0704 700 7999, 0704 700 7999, or 0805 388 8933, 0805 388 8933. Okay, so you said something about people helping and being a first aider, being trained as a first aider, but most people are actually scared of involving themselves in this first aid of a thing because they believe that once they do it or once they assist some accident victim, they are being faced with some legal trouble, like legal blaming, and be like, okay, at the end of the day the person eventually dies or something, they'll be like, it is the person that attended to them at the first point of that incident that caused the death, and they want to start blaming the first aider. What do you think about that?
People should, thank you so much. People should not be afraid because you are saving life. When you are trying to save life, let it have at your back of mind that you are doing something very important. Now, you are with a patient or you are with someone that need a medical intervention. Do all your best to get that person to his or her optimal functioning. Now, there's a rules that we always do. When you bring a patient and you are just like an EPA, let me use that word. There's a book that we always give you at my place of work. You write your name, okay, because number one, you are the one. You are like eyewitness. You write your name, you write your details. I brought a patient and this is it at social area. It's a right thing to do. Because sometimes it's another way when you save a life and the thing goes around that is no, this is not what really happened. This is not the real issue that happened. Because some people might hide under that. That is why they are afraid. But if you know that it's a road traffic accident and you save it, a lot of people they use their own cloths, they use their own wares to save life. You see blood on their body. No, it's not. That time, your mindset, your brain is there that this person must be. Let us rescue this life, and that is it. Because you can't see your human being bleeding, and you won't save or you won't attend to the person. You should have a pure mind, your pure heart to save life. Because you too can be a victim. Let us always have that at the back of our mind. So all first aiders should try all possible best to save life. Nothing is attached. The only thing is just documents and just tell us the history. Because from the history you give the personnel is the one thing that you will use to work on, to treat the patient. To have the idea of what has transpired, have the idea of what happened at a particular time. So that is it. So you don't need to be panicked. You don't need to be anxious. So that is it. So we are good to go when you see something like that. Help, and you'll be good.
Okay, but some people are always scared of infection, even though they want to help. Like, okay, I want to help now, but I'm scared of. Okay, I like you rightly said. He said some people even use their clothes to, like, okay, let me just use it to bandage this person and
improvise.
Okay, to improvise. So now some people are like, I'm so scared of blood. I don't want to have I don't want to get contaminated
Okay.
with the blood. So what are the precautions? What are the other ways? Like, is there any preventive method like that person can use? Because as at that moment, there is no first aid kits around.
The truth is this: don't let us lie to ourselves.
Okay.
A layman won't think about infection. A layman person won't think about blood and everything. What are that particular the main particular thing on that person's mind at that particular time is just this person is dying. Oh, let us save this life. Oh, people will troop out. When you are carrying the patient, also you see blood stain on them, on their body also now. It is when you get to the hospital that you'll be thinking about, okay, let us put on gloves to be on the safe side. On the safer side. How do you know that? Okay, me that I'm passing by. How did I know that this person has infection? No, now. So don't let us don't let us encapsulate some things that encapsulate something that because this person is a victim of road traffic accident. So no, don't let me touch him. No, don't let me, no. By the time you are doing that, the time is counting. The time is counting, and when time counts, and you don't say that the guy is going down, the heart is shutting down. The organs on the body is shutting down. So the only thing is just when you see all this kind of thing, I would say start when there's no airway, the breathing is there. You start your CPR, cardiopulmonary resuscitation. You do 30 compression, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to 30. You give 2 breaths. But that 2 breaths, some people say mouth to mouth again because you can use a handkerchief. But because inside the hospital we call it handbook bag, ear bag. So you give 2 breaths, 1, 2, 1, 2 after 30 compression, and that is it. And it will be a joy that somebody that is already unconscious coming around. So you don't need to be scared, and that is the truth. I will encourage our listener to always give adequate assistance, help to anybody who is a victim. Tomorrow it can be you. It can be our family members. So let us save life. And we are saving life when we are not psychologically, mentally, physically, morally stable. You cannot save life. That's the truth. So we should take care of ourselves
before we think of saving
another's lives. That is when you want to save life. Am I fit to save life? Because when you are doing CPR and you me too, oh God, I'm having chest pain, and a lot of things. What is the essence? You need to take care of yourself. Eat. If you cannot do it, call for help. And you give, and one thing is this, plus or minus, I omitted something when we are talking about first aid box. Plus or minus, they always hand glove. So you put hand gloves there. And you can put your face masks. So that is it.
Okay.
So
all right. While you were talking earlier, you talked about people with epilepsy, and when they want to give them a first aid, most people even put spoons in their mouth. Like they must not grind their teeth together. So now the question I'm going to be asking is, what is the first step of first aid that you can render to someone with epilepsy?
Yeah, thank you so much. Epilepsy is when there's a kind of
seizure.
Seizure is just like it's the neurons from the brain. Yeah. You see the person jacking reflex and foaming from the mouth. the first thing you need to do, you check your environment, your own safety first.
Okay.
Number two thing you need to do is just, is there any injury, anything that can harm the patient? Because when you see them forming, the jacking is so severe that they get injured. So you look at the environment. Is there any sharp object that can injure them? You take it away. You don't move them. You don't touch them. The only thing you can do is just let that subside. After it has subsided, you now put that patient in a recovery position, because you are trying to prevent aspiration, and you are trying to prevent falling back of the tongue. You don't need to put anything, because by the time you introduce anything, the patient, by the time he's jacking, because he's unconscious, you started biting the tongue and putting the iron thing now, spoon. By the time you are clenching on it, you are causing more injury. Bleeding, you see the blood coming out from the mouth and everything. It's not advisable. By the time you have already saved a person, move to the hospital. When you get to the hospital, they know what to do. That is when they have to place the patient on medication, do a lot of investigation, and you understand tests. They run some tests. When they do the test, the person on the drugs, after observing the patient for some days, he goes home, and the patient will be on drugs. And these things are caused, this epilepsy are caused, the causes is just, when our parents are not so conscious about the children when they are small, when the whole thing started when they are young, when the boy or the girl or the baby, let me use the baby, fall, and they don't know. The brain is so coordinated that if anything happens, it just stabilizes body system, and the brain, the body, the organs, they work together, and that is it. And when you apart from other people who use steroid, sometimes substance abuse, alcohol, and other things
like
hard drugs and everything, because when you do that, it have another adverse effect on the body. So when you see all these kind of people, anybody that is having seizures, the only thing is just don't do anything.
Move the person, just leave the person.
Exactly, and let him come, because that person, when he recover, he will say, where am I? What have I done? What is happening to me? And that is it. But by the time you understand, you are this, you take to the hospital. Don't think that after that episode, you won't going to have that again. It will. And again, sometimes when you are studying a patient that is having seizures, you check your time. How many minutes does it take? Because because some they use 5 minutes, some they use 10 minutes, some they use 15, some they use 20 minutes. Because these are the information that they
would ask when you get to the
hospital. Okay. The practitioner will ask. They will tell you, how did it start? What do you do? What triggered it? It's not everybody that's that noise, sometimes illness, and that is it. So the time is almost important. The jacking reflex take like 15 seconds, 30 minutes, and everything, and it aborted. And that is it. By the time you try to help, you see that, where am I? Please, and you see them crying. That is when they need you. Do you understand?
All right.
So that is it.
All right. We'll be going on a commercial break now. But before we go on the commercial break, I'm going to be taking this health news. Red Cross unveils 2.5 billion funding fundraising initiative to support vulnerable Nigerians. The Nigerian Red Cross Society, with support from International Federation of Red Cross and Red Cross Crescent Society, has launched an emergency appeal to assist the most vulnerable persons across Nigeria over the next 18 months. The appeal targets the sum of 2.5 billion with focus on enhancing livelihood, health, nutrition and wash service in the most affected region. The Nigerian Red Cross Committee Society intended to raise 2.5 billion to avert the effects of severe hunger and malnutrition in Nigeria. And according to the widely stipulated reports, unless emergency steps are activated and implemented, over 3.1 million Nigerians will face flood insecurity between January to October 2024. Factors such as conflicts, inflation, and economic challenges are worsening the situation. Okay, don't go anywhere else. Plus T continues right here at Omoluwabi Radio 87.7 FM.
It keeps you alive. Hey, hey. Your health is your wealth. It keeps you alive.
For the best in news, talk, and music, Omoluwabi 87.7 FM is your best dial. Keep listening.
My Sabi people, how una dey? Na Sabi people dey listen to Sabi Radio. Omoluwabi Radio 87.7 FM, na dem be Sabi Radio.
Hello?
Hello there. I'm at the hospital right now because the kills are seriously ill. I've been on a long queue and the doctor is here to attend to me. I don't know what to do again.
You know what? How about the numbers I gave you while leaving?
Oh, the e-doctor numbers?
Yes.
Call them right away. They will attend to you immediately.
Hello?
Darling, just like magic. Junior is playing. Even Princess is eating like an adult.
You know I've told you to calm down. Our family is covered with e-doctor premium plan. With eDoctor, you have access to healthcare at your fingertips. Stop wasting your productive hours while waiting in the clinic for doctor. Subscribe today to any of eDoctor plans and enjoy online chat and call consult, laser therapy, medical outreach, and home care services. Simply dial 0704-714-2000 or 0701-000-8670. Log on to www.edoctor.com or visit us at eDoctor, number 2 Ocean Street, New Bodija, Ibadan. eDoctor, inspiring wellness.
At break time, when my champ needs to keep going, he's going to need his favorite snack, made with the goodness of malt, milk, cocoa, and crunchy Niger-grown maize, containing calcium, iron, and fiber.
Break time is crunch time, so give your champs this delicious crunchy delight to keep them winning all day. Milo and a snack of future champions.
Cholera is a deadly disease that spreads through contaminated water and poor hygiene. Say no to germs with Hypo. Disinfect your home and drainages with Hypo bleach. Wash hands frequently. Stop open defecation. Wash your toilets with Hypo toilet cleaner. Together, we can prevent the spread of cholera.
In any emergency, every second counts. The Nigerian Communications Commission brings you the 112 emergency toll-free line, available nationwide, anytime, any day, absolutely free. With just 3 simple digits, 112, help is on the way. Dial from any network at any time. No charges, just immediate response. Remember, the 112 toll-free line directly connects to emergency services. If you need the police, fire service, ambulance services, Federal Road Safety Corps, Nigeria Civil Defense Corps, and more. Because when it comes to saving lives, we're all in this together at NCC. NCC, connecting Nigeria.
Omoluwabi 87.7 FM.
When you hear the word integrity, what comes to your mind?
Uprightness,
genuinity,
Honesty.
rectitude.
Omoluwabi Radio, that is what we represent. Keep listening to the voice of integrity. Omoluwabi 87.7 FM.
It keeps you alive. Our health is our wealth. It keeps us surviving.
Yeah, welcome back from that commercial break. It is still Omoluwabi Radio 87.7 FM, and I'm still your wonderful host, Ebumoluwa Adibu. I have with me in the studio this wonderful afternoon a very beautiful and sumptuous sister. Okay, I would like you to please introduce yourself.
Good afternoon, viewers at home. I'm Nurse Oladrin from eDokita.
Okay, so what is eDokita all about?
eDokita is an organization, is majorly telemedicine. Yes, we deal with telehealth. It's an organization that is meant to cater for individuals' health. You can consult us for online and virtual consultations. We do physical consultations, home services, and we do outreaches. You can call us to sponsor any outreach within Ibadan, outside Ibadan. We are available. And we also have plans for individuals and for organizations. We have plans for family, and it is at affordable rates.
Okay, so in case anybody wants to contact you, how can they contact you? Where can they find you?
If you want to contact eDokita, you can also call us if you have any health concern, if you have any questions regarding your health, if you have any issues you want to get some clarification and information from. You can call eDokita on 070 1000 8670. I will call that again. 070 1000 8670. You can also check us on Instagram, on Facebook, on TikTok, on X, on all social medias. You can check us eDokita. Just type eDokita and you see us.
Okay. So,
Yes.
Physical office?
Yes, we have a physical office at number 2 Ocean Street, Bodija, after Bovas filling station.
Okay, all right. Thank you very much for coming
Yes,
around.
thank
All
you.
You're welcome. Okay, sir, the last word for the first aider respondents at home. What is your word of encouragement to them?
Yes, I will tell the first aiders to be proactive when they are doing their own job, and they should not be afraid. They should be more focused, and they should try and save the life of any victim they come across. And one thing is just they should remove in their mind agitation, anxiety, and you should be more of saving of the life